Have you ever wondered what actually is epilepsy and what are its types? How is it cured and what are its causes, symptoms, and diagnoses? Well, I'll be answering all of your questions, but before that, let me introduce myself. I'm Raneen Haytham, a junior from Al Jirra International School, and I would like to share with you the information I gathered after a research I conducted about epilepsy. Epilepsy, which is also known as seizure disorder, is a disorder in the nervous system which causes unusual actions and behavior and loss of consciousness. It can develop for anyone and affects both males and females of all ages and races. But new epilepsy cases are mostly common in children, especially in their first year. Seizures occur when abnormal electric signals from the brain change the way the body functions. There are many types of seizures that are grouped under two main categories, which are partial seizure, which is in 57%, and the generalized, which is in 43%. When a part of a brain is initially affected, it is referred to as partial seizure. It can cause déjà vu, which is the feeling that events have happened before, and many other strange feelings that are hard to describe. Not only that, but it also gives a person unusual smells or tastes, and intense feelings of joy and fear. This image shows the encephalography test of partial seizure and how it's only affecting a part of the brain. We have two types of partial seizure. The first type is the focal aware seizure. It can also be named as simple focal seizure. The person facing the focal seizure remains awake and conscious about whatever is happening. The second type is known as complex partial seizure. The diagnosed person is not aware of whatever is happening and makes random movements such as hand rubbing, lip smacking, random noises, and much more. As a matter of fact, the person will not even respond to anyone else during the seizure and will not remember anything happened. The electroencephalography, EEG, is a test that records the brainwave patterns. The normal electrical activity in the brain makes a recognizable pattern, like the first image here. But the second image right here shows the abnormal patterns that indicate seizures and other problems. Generalized seizure. The abnormality in the electrical activity that starts with one part of the brain and then spreads to two hemispheres, depending on how the electrical discharge is spread, is known as generalized seizure. The imbalance of the two circuits, which are the inhibitory and the excitatory circuits of the brain, causes generalized epilepsy. This image right here shows the electroencephalography test of generalized epilepsy and how that it's spreading throughout the brain. Generalized epilepsy has different types. The absent seizure, which is also known as petit mal, can cause rapid blinking and staring into space for a few seconds. The second type is the tonic, which causes muscles in the body to become rigid. Type 3 is the atonic seizure, and it causes the muscles in the body to relax. The fourth type that causes short shivering in the body parts is myoclonic. Clonic is the fifth type, and it causes periods of shaking in parts of the body. Tonic-clonic, which is also known as grand mal, is the sixth type, and it can make a person cry out, lose consciousness, fall to the ground, and have muscle spasms. Now, let's talk about the symptoms. A person may experience a variety of symptoms before, during, or after a seizure. Not everyone has all of these symptoms because they depend on the type of the seizure an individual has. He or she should seek a medical help if any of the following occurs. Number 1. Weakness. It can take place in any area of the body. For example, it can be an arm or a leg, or both. Loss of consciousness. Some seizures may cause loss of awareness that occurs out of the blue and can last for a few seconds and sometimes can last 2 hours. Number 3. Anxiety. Before a seizure, the only symptom for some people that a seizure is about to occur is anxiety. People can experience intense anxiety and fear. Number 4 is staring. One of the symptoms, especially for absent seizure, is staring. An individual may be daydreaming or lost in thought, where in reality, they are actually experiencing a seizure. Number 5 is contraction and jerking of muscles. Multiple muscles in the body contract and jerk. Involuntary muscle contractions can occur in isolated areas in the body too. It's time to discuss about the causes of epilepsy. Half the people with this condition have no identifiable cause. However, the other half, the condition may be due to many factors, such as the genetic influence. Some types of epilepsy are inherited to the next generation. They are categorized by the type of seizure or by the part of the brain that is affected. Number 2 is head trauma. Head trauma results from car accidents or any other traumatic injuries. Prenatal injury. Babies are sensitive to brain damage that is due to poor nutrition, oxygen deficiencies, and infection. This brain damage can result in epilepsy or cerebral palsy. Number 4 is infectious disease. Diseases such as meningitis and AIDS can cause epilepsy. Developmental disorders. Epilepsy can sometimes be related to developmental disorders such as autism and neurofibromatosis. It's clear that we're going to talk about the diagnosis and treatments now. To diagnose a condition, doctors usually review the symptoms and medical history, and depending on that, doctors order several tests to determine the cause of the seizures. These tests may include a neurological exam, blood tests, CT scan, PET scan, MRI, and fMRI. A neurological exam. The doctor may test the behavior, the motor abilities such as the ability to perform a skill, and mental function to determine if a person has a problem with their brain and nervous system. Blood tests. Doctors may ask for a blood sample to check for infections, genetic conditions, blood sugar levels, and etc. Computerized tomography, CT scan, is a diagnostic test that uses X-rays to obtain cross-sectional images of the brain. CT scans can reveal abnormalities in the brain that causes most likely seizures. Positron emission tomography, which is known as PET, is a scan that uses a small amount of low-dose radioactive material that's injected into the vein to help visualize active areas of the brain and detect abnormalities. Magnetic resonance imagery. It's also known as MRI. It's another test that is used to diagnose epilepsy. It uses forceful magnets and radio waves to set up the detailed view of the brain. This helps and serves the doctor to detect the abnormalities in the brain that could be generating seizures for a person. And lastly, functional MRI. It measures the changes in blood flow that occurs when the definite parts of the brain are working. Doctors may use the fMRI before a surgery to identify the exact location of the demanding functions, such as speech and movement, so that the surgeons can avoid injuring those places while operating, of course. Now, talking about the last part of our video, which is treatments. Treatments can help most people with epilepsy have fewer seizures or stop having seizures completely. Doctors will most likely want to try epilepsy medications before surgeries or any other type of treatments. Epilepsy medications are sometimes called anti-seizure or anticonvulsant medication. It changes the way the brain cells work and sends messages to each other. This medication depends on few factors such as the type of seizure, the age, the gender, and other medical conditions. Despite their advantages and help in reducing seizures, they have side effects like weight gain, speech problems, memory and thinking problems, loss of bone density, and much more. More severe but real side effects include depression, suicidal thoughts and behaviors, inflammation of certain organs, most probably the liver. However, surgeries become an option when medications fail to provide adequate control over seizures. A surgeon removes the area of the brain that causes seizures. Doctors accept to perform a surgery when tests show that seizures originate in a small area of the brain and this area does not interfere with vital functions, such as speech, language, motor function, and vision or hearing. Potential therapies are another type of treatments. They offer an alternative of treating epilepsy. Potential therapy examples include vagus nerve stimulation and ketogenic diet. Vagus nerve stimulation. In vagus nerve stimulation, doctors implant a device underneath the skin of the chest. It is called vagus nerve stimulator. The wires from this device are connected to the vagus nerve in the neck. This battery-powered device bursts electrical energy through the vagus nerve and sends it to the brain. It reduces seizures by 20% to 40%, even though it's still unclear how this inhibits seizures. The ketogenic diet is another potential therapy used to reduce seizures. Some children have been able to reduce their seizures by following a strict diet that's high in fats and low in carbohydrates. The diet changes the level of chemicals in the body, so the body breaks down fats instead of carbohydrates. Moreover, researchers nowadays are studying many potential therapies for new treatments for epilepsy. Those treatments include responsive neurostimulation and external nerve stimulation device. Responsive neurostimulation. It involves an implantable device that helps prevent seizures. These closed-loop devices analyze the brain activity patterns to detect seizures before they happen and deliver an electrical charge or drug to stop the seizure. External nerve stimulation device. Similar to vagus nerve stimulation, this device would stimulate specific nerves to reduce the frequency of seizures. The only difference is that this device could be worn externally, so that no surgery is needed to implant this device. Here, I came to an end with my presentation. Thank you so much for your good listening, and I hope you have a wonderful and lovely day.